Welcome back. Here's an interesting fact for you. Studies show that more than half of all adults will suffer from some form of neck or back pain during their life. And if you're among the millions looking for relief, you'll want to listen to what our next guest has to say. Dr. Thomas Kramer is the Medical Director of Physicians Diagnostics and Rehabilitation, also known as PDR. And he's here to tell us what's unique about their services. Well, good morning and welcome to you.
Good morning.
It's true. I've had back pain on and off, neck pain. I've got a little neck pain right now. We'll have to talk after the show. But it's very typical of a lot of people. What conditions do you treat at PDR specifically?
Well, at PDR we treat primarily patients with chronic or persistent neck and back pain.
So not the kind of thing that I might have this morning, but something that lasts a lot longer, that inhibits your everyday life?
Yeah, I would say most of our patients have had a problem beyond a 12-week period on average.
Yeah. So how common is this neck and back pain like that?
Well, you've already mentioned it. Low back pain itself is almost universal in the adult population. About 4 or 5 of all adults will have at least one episode of severe back pain in their lives. And it's going to the doctor with back pain is second only to common cold. So it's a very common problem, very big problem.
There have been traditional treatments over the years. People have been dealing with this for a long time. Talk about some of the traditional treatments that people may have already had.
Well, the standard treatment depends, of course, on the severity of the problem, on presentation, but it may include things like medications, physical therapy modalities like ice and heat, and ultrasound, massage, chiropractic treatments, in rare cases, cortisone injections. And what's noteworthy about those types of treatments is they're considered passive care, and that means that the patient's not really involved. They're receiving care, and they're idle during it. And that's okay, and that's appropriate earlier on, but at some point we have to move people from passive care to a point where they're actively involved in their care, such as with rehab.
Well, and that brings us to the newer treatments, too, that are out there. What's new on the horizon?
Well, I would say the latest trend is to treat back pain earlier and more aggressively with spinal rehabilitation. And for a lot of our patients, this idea of being more aggressive is a bit of a new one for them. They've been told many times that if it hurts, stop doing it or ease up. And we've got a wide body of research now that says that giving that advice is probably not a good idea. And the longer a person protects their back, the longer they stay inactive, the worse the problem gets. So in our clinic, for example, it's not uncommon to hear us say, if it hurts, that's okay, keep going, we'll help you get through.
Okay. You do have programs that you offer specifically at PDR. Tell me about those.
Well, our program is considered an aggressive rehabilitation program or progressive rehabilitation program. And we use specialized equipment called Med-X to help isolate muscles, and because of the equipment we can be a little more aggressive without injuring the spine. This is a 2 to 3 month program. Patients are with us for almost 24 visits, and so there's a lot of time to help them get through.
Now we're seeing some people doing what looks to me almost like gym equipment with we had small weights and then some other apparatus. Obviously you consult with them and talk about their progress. You were mentioning the 2 to 3 month program, and you mentioned Med-X.
Yes.
Specifically, what is Med-X?
Well, Med-X is specialized exercise equipment, and it was designed, you can see it I think on the screen there, it looks a little intimidating at first, but what this equipment does, it allows us to isolate very specific muscle groups in and around the spine, and then we can take the muscles through a full range of motion. And again, because of how the equipment is designed, we can be a little more aggressive with it.
Yeah, because on first glance, this looks like a gym you might walk into, but these are very specialized pieces of equipment.
These are only operated by therapists.
Okay. How is PDR different from other spinal rehab programs? Because we have heard about other businesses that might talk about the same progress.
Well, one is it's medically supervised, and the main uniqueness of our clinic, of course, is the equipment. There are other Med-X programs around, and good ones. We feel we're unique in that we do have doctors that are on site. All of our sessions with the patients are one-on-one, so we don't put people in the corner with exercises. They're with the therapist at all times. Also, all of our therapists are trained and certified in not only MEDEX, but also various manual techniques, which are hands-on techniques, which can be very useful if a person struggles or if they flare up. These types of things can help them get through the program.
And you mentioned that the patients have a 2 to 3 month program. How's the satisfaction been with your patients with this program?
Well, if they get through, and most do, it's pretty high. We've had a little over 10,000 patients go through our program successfully since we opened up. And we survey all of our patients. We ask them a number of questions. And one of the questions we ask is, if you had to do it all over again, knowing what you know right now, would you do it again? And 92% said they would.
Which is speaks volumes about your business.
It's not 100%, but
that's
not much
very,
is.
very high. Thank you for coming in today and sharing this information with
My pleasure.
us. For more information or to talk to a therapist or doctor to see if you might be a candidate for the MEDEX program at PDR, call 952-908-2700. You can also log on to pdrclinics.com. And still ahead this morning, peaceful solutions for dealing